everyone. I'm Lisa Weber Curry, Manager of Clinical Services at Ascension Counseling Center. You're watching Ascension Counseling Center's video newsletter, where we talk about the services we offer and how you can benefit from them. Thanks for joining us. Today we'll discuss a new service we're offering at the agency, helping people leaving prison re-enter society successfully. We'll visit with Suzanne Hamilton, Director of Ascension Counseling Center, to discuss this valuable program. Please stay with us for the next half hour or so. Our newsletter begins right after this message.
Ascension Parish, a parish steeped in tradition. It's a place where generations of families have continued to enjoy a lifestyle that centers on community living and community celebration. It's a place where we care about each other and we care about ourselves. For more than 50 years, the Ascension Counseling Center has continued the tradition of helping individuals and families change behaviors and change lives. The Ascension Counseling Center.
Welcome back, and thanks for staying with us. Today we have with us Suzanne Hamilton, and I'm really excited to hear about this new service we're offering at Ascension Counseling Center, the Community Reentry Services. Would you kind of fill us in on it?
Yes, Lisa, I'll be happy to. And I'm really pleased and excited about this new service that we're offered. We have recently joined a coalition of reentry professionals in the capital area, and that means that basically all of the parishes that surround East Baton Rouge Parish are taking part in this coalition, and it's designed to help people who are being released from prison to reintegrate back into the community in a healthy way to get all of their needs met, with the ultimate goal of not going back to jail. And right now, about 56% of people who are released from prisons and from jails are going back. And so our goal is to help them eliminate any barriers that would help them to get reintegrated back into their families, to their communities, to employment, and to be able to be healthy and to stay out of jail.
And that's a valuable service because the recidivism rate is extremely high for offenders. You know, they end up going back, and it's not just in our state, it's across the country. So to provide this service is great. So what are the highlights of the service? Well,
the highlights of the service, there are two basic things that we provide. Some are services that we provide directly in our agency, and we'll kind of review those for you so that you'll know what they are. And the other one is we have a case management service for all the other services that we don't provide in our agency, things like housing and employment and rent assistance and utilities and food and those types of things that most people in the community are not aware of, but that we know that we've done networking with all the other agencies in the community, and so we know the services that they offer, and we are able to have a case manager work with the people who are being released from prison so that they can have access to all of these other services. So basically will be two things. One is the services that we provide in our agency, and the other one is a case manager in our agency who will help them access all the other services that we don't provide directly. And it's kind of like a one-stop shopping, if you will.
And that makes sense, because even if people are aware of the services that are out there, sometimes they don't know how to connect with those services. So our social worker who's serving as a case manager will help connect individuals with the services being offered.
Yes, and if they want to, you can come into our office and sit in the social worker's office, and she'll help you make all of the phone calls to get all of those services lined up. Many of them take appointments, work by appointments, and so she'll help you get set up with an appointment so that you'll know exactly where to go and when.
Okay, so let's talk a little bit about the services we already provide before we move in more detailed into the new services.
Well, and as you know, and we hope that we've communicated that clearly over the years that we've been doing this program, is that we do have a lot of services that we offer. And one of them is a chronic pain management group. And so for anyone who has any type of chronic pain, back pain, any other kind of injuries, anything like that, we have a group that they can take part in, and it would help them to be able to manage their chronic pain. Now, we don't prescribe medications or anything like that. What we do is it's like behavioral and thinking changes that can help you make changes to yourself, your behaviors, and your environment that will help you to be able to cope better. And we also help people work with their doctor to help their doctor understand their pain level and be able to treat it well. So we kind of train them how to talk with their doctor and keep journals of how their pain is doing over time between their doctor visits so that they can get better care when they do see their doctor.
Right. And this is also useful information to take back to their families, because sometimes families struggle to understand when a family member is in pain. So this will give the family members a better understanding as well.
The other thing that we provide is individual, couples, and family counseling, and this is really important. If you have a family member who's been in jail and is just being released, you know, especially if it's been years, you know that your family has made a lot of adjustments over time that kind of don't include that family member. Other people have taken over that person's roles, and so now they have to get reintegrated back into the family in a way that is not disruptive. And so sometimes that's hard to do. Especially if your children have been young when you went in, and if you have a 6-year-old and you've been in jail for 3 years, you've missed a lot from the time they grow from 6 years to 9 years.
There's been a lot of development in that
there has,
life.
and in the family and in what the family's been doing. So it's an opportunity for the family to come together in counseling as a whole and work through all of those adjustment issues and get back into the family with as few bumps and bruises as possible.
Okay, great. And we also have a psychiatrist on staff as well?
We do have a psychiatrist on staff. If anyone has been diagnosed with any kind of mental disorders, any kind of issues at all, when they come back, they can come and see our psychiatrist and have their medications continue to be prescribed for them. And our psychiatrist will do an evaluation, and he'll also do medication management for you. Okay,
great. And we have other groups going on at the agency, right?
We do have some other groups. We have anger management groups. So sometimes people have conditions of probation when they've been released, and that might include an anger management group, or it might include our domestic violence, nonviolence group, something like that. And so whenever you come to us, you'll let us know what the conditions are of probation, and we can provide those services. Sometimes they're required to have a substance abuse evaluation as a condition of probation. So we can do the anger management group. We can do this. We also have a smoking cessation group if people want to stop smoking. And we provide the nicotine patch free of charge for that. We also do, like I said, substance use evaluations. So if it's alcohol or other drugs, we can do this substance evaluation for that, and as part of that,
provide the treatment as well.
Yeah, we provide the treatment for that. If it's, let's say we find out during the assessment that they need inpatient treatment or detox, we're going to make the recommendation for them. And that's the other way that we help the family, because we have a list of all of the treatment facilities, and most people in the general public don't have that information. So our counselors will give them a list of all the treatment facilities and help them find the one that matches the best for them. And when we call and try to get somebody into a treatment facility, we usually have better luck than just an individual calling, because we've developed a relationship with most of the agencies.
And we know what information they're looking for, what needs to be sent. So in essence, nobody gets sent away. You know, even if our services aren't what they need, or they need something more in depth, we set up all the referrals and send them to the appropriate places.
So we really work as a part of a team. You have a team of people working with you to help you meet all of the different needs that you might have. And you know, I didn't say this at the beginning, so let me say now, all of these services are free to people who are coming out of prison. And so we've already made a commitment that anybody who comes to us for services, if they've been out of jail for 3 months, they can come to us free of charge, because we know you haven't been working, and we know that there's a financial hardship on the family if one wage earner is out of it. So we can provide this service, and these services are available for both men and women as well.
I think that's very important, because that removes one of the biggest barriers to people seeking help when they're reentering society. So that's a really great service to provide free of charge.
And that, I always like to brag on our parish. We can do this because, as we say at the end of every program, we're supported by a 2 mil property tax, which means that $2 from every $1,000 that people pay goes to support our agency.
Right.
And because of this, we can offer free and low-cost services. And this is just an example of that. And, we just can't thank you enough for being generous. The people of Ascension Parish are generous and caring about their community. And, our millage is renewed every 10 years. It was renewed in 2010.
And thank you.
Yes, thank you very
community.
much. It'll be up for renewal again in 2020. And at that time in 2010, and ever since then, the trend has been that no new taxes have been approved, and we can understand that. However, these millages, like Council on Aging and other social service agencies such as ours, have continuously been renewed, and so we really thank the parish and all of the residents for doing that. And it allows us to offer a service like this. The coalition came into the parish and asked President Matassa, could they have a presence in Ascension Parish? He delegated that to us, and we were just able to say yes without any reservations. And so that's a wonderful thing to be able to do.
And it's another example of our community giving back to its residents. So, so that's great. One other program we also have that I think has made a difference in Ascension Parish is the Certified Medicaid Center. Because people don't have to travel outside of the parish now to sign up for Medicaid.
And at the time that we became a certified Medicaid application center, the only other agencies providing Medicaid applications were just to their clients or just to their patients. And so we provide that for anybody in the community. Anybody can walk in. They will sit and work with our social worker, again, that's Sarah, and they'll sit and work with Sarah to fill out the application online. And the other service that we provide free of charge is any documents that need to be mailed in as a result of that application. We make the copies free of charge and we mail it for you. So those are all done on behalf of anybody who's looking for Medicaid.
Makes it really easy for our community members. And again, anybody can walk in. You don't have to be a client of our agency to apply for Medicaid. We will help you. Just walk in.
Yes.
Okay, great.
And most of the people who are coming out of jail are going to qualify for Medicaid because they haven't been employed.
Okay, really good to know. So those are the services we already have in place. So now we'll move on to talking about the new services we're starting to help people re-enter society.
All right, so our case manager, again, our social worker, Sarah, is going to work with people to help them find resources for services that we don't provide. And that's going to be things like housing. If you're coming out of jail, you may be able to return to the housing that you had before you went in, and some people are fortunate to be able to do that. But other people have lost their housing. You may be single and have just not been able to keep a housing and have to look for something else. Or you may not be able to return to your family that you left. And so we look for different types of housing for people. They might need emergency housing for when they immediately come out. And we'll help them find that, or they may need transitional housing where they can live, for a short period of time, up to 3 months or so, up to maybe up to 6 months. We'll help them find that, or we'll help them find permanent housing.
And some of the other services are helping them find employment.
And with employment, we work with Ms. Brendalyn Scott at the Louisiana Workforce Commission. And they're located right on Burnside, across from the post office, at the corner of Burnside and Oreith Row. Well, Ms. Brendalyn has some programs, grant-funded programs that are specifically designed to help people get employed when they're coming out of prison. And so these are some things that we're aware of, so we're going to help connect people with Miss Scott. We'll call and make the introductions, and then they'll go in and work with her, and she'll help them. And she actually has employers who are committed to hiring people out, who've come outside of jail and prison.
That's wonderful.
Yeah, it's a federal program that they can get tax relief, tax credit, or tax breaks for hiring people who've come out of jail. So we have a number of employers who have signed up to take part in that so that they can get the income tax breaks. And so she'll work with them to get them employed. And if she feels like they need additional training to get employed, she also has money for that. And River Parish's community college has some industrial type certification programs. So they have one that's scaffolding building, or they have welding, or they have other things like that. And so they might put you in a training program so that you can become more employable.
Yeah, because all those are trades that companies are readily looking for potential candidates to work in those areas. So I think that's great. And to have money specifically set aside to work with offenders returning to the community is even better, because we hear that all the time when they come in for services is, my probation or my parole officer or the judge has ordered me to find employment. I'm looking, but I can't find it. And some of them are sincerely looking. So now to have a connection with someone who can help them, that's a great thing for them.
Somebody who already has committed to working with people who've been convicted of a crime.
Right.
You know, so that's going to save a lot of effort on people's part. And, you know, a lot of people will ask, when we talk about employment, they'll ask about the TWIC cards. And, you know, that's becoming more and more common that those are needed. And the DA's office has a program where if you've been turned down for a TWIC card due to convictions, they have an appeal process that they can go through, and they'll work the appeal for you and write a letter of recommendation so that you can still get a TWIC card even though you have a record.
Right. Talk about removing barriers.
Yes.
Yeah, that is great. Okay. And there are other services as well. You talked about the training. There are GED programs to help them get their GED, which is oftentimes a barrier as well if you don't have the high school diploma or GED. So they can get the training for that. But it also takes it another step to providing, because when you come out of a penal institution where you were getting your medical services, your dental services, now you're on your own. But we have referrals to help them get those services.
One of the referrals for medical is that St. Elizabeth Hospital has a free clinic that's in the health unit in Gonzales, and they only serve people who don't have insurance. And so for any medical needs at all that people have, they can just walk into that clinic or call and make an appointment, and they'll be able to have their needs met. They'll also can prescribe, so if you need blood pressure medicines or anything at all like that, they will be able to prescribe that for you.
That is wonderful.
And we do have also some places that we know of that provide prescription assistance. So there's a St. Vincent de Paul has a pharmacy in Baton Rouge where they'll fill prescriptions free of charge.
Regardless of what parish you live in.
Regardless of what parish you live in. There are some other agencies that will provide funds for prescriptions as well. And also Walmart has a $4 prescription program. And they have over 360 prescriptions listed on there. So if you're having trouble getting your medications filled, you can go to one of these other agencies, but you might also be able to go to Walmart and get it filled for $4. So,
and St. Elizabeth's will definitely help them with any appropriate referrals as needed. So that is wonderful. Also veteran services.
Yeah, that's the other thing. If you are a veteran, you're also eligible for a lot of these same services through the Department of Veteran Services. And in Ascension Parish, that's Mr. Wilma Jackson, and he will take care of working with you for any needs that you have. And if you do that, now you've got 2 case managers working with
Exactly.
you. One is us, our social worker, Sarah, who'll be working with you, and then Mr. Jackson at the Veteran Services. And they also do provide homeless services and employment and education and housing and other things like that. Insurances. You can apply for veterans insurance, or if you're older, you can apply for Medicare as well. And so all of those, if you're a veteran, we'll get you connected with the person, the rep in Ascension Parish, and then you'll have 2 different case managers working with you to meet all of your needs. And so that's an extra value that people get.
Yeah, that's an added bonus because so many veterans are looking for help, and this is it's like a one-stop shop for them as well. They get a double one-stop shop, so it really works well. Some of the other things we were talking about being able to provide services for the appropriate referrals is the food, clothing, the transportation, the rent, down payment for utilities, senior services, health insurance. Tell us a little bit more about those.
All of those kind of things. For the health insurance, we will, again, if you're a veteran, you can get insurance through your Veterans Association. If you're 65 and older, you can qualify for Medicare, or you can apply for Medicaid based on your income. And if you're looking for housing and you need, there is an agency, a couple of agencies that will provide you with your first month's rent and your down payment for that. And then they'll also provide some assistance for utilities. So there are some places that will provide paying for the utilities for the month or 2 months, and maybe up to 3 months. I don't remember exactly now. And most of them work by appointments, and so our case manager will help you to schedule an appointment so that you can get your down payment and your first month's rent so that you can afford to move into your own place.
Yeah, that's a big deal, because you will hear individuals say, okay, I've gotten a job, I need a place to stay, but I can't put a down payment, I can't pay first month's rent until I actually start collecting a paycheck. So to have that done for you is like a burden lifted, and it really gets them off on the right foot. So that's a great thing.
Yeah, and it's, if you have to start out in the hole or behind, you almost never catch up. So this way we allow people to start on an even footing so that when they go to work, they are not behind with all of their bills already.
And they can go to work with the thought, I'm moving forward. I'm not trying to catch up, I'm moving forward, and they feel like they have some things within their control, which in and of itself helps them to be more successful in reintegrating into society.
Yes.
So these are wonderful programs and wonderful referral sources to hopefully help cut down on recidivism.
Yes, and hopefully, especially if there are any substance issues, changing your environment, changing the people that you hang around with, learning to recognize your triggers, which trigger your use. All of those are things that we would cover in our substance abuse treatment groups. And to help you, hopefully you've been off of substances while you were in jail. And we can help you keep that when you come out and get back into your old environments and
help
learn
them
how to handle
maintain that sobriety. Give them coping skills to deal with the environment they're going back into, because oftentimes that becomes a big trigger. So,
and we do have a counselor at the Ascension Parish Jail. His name is Daryl. And if you have someone who's in the Ascension Parish Jail, they can ask to see him, and they can do some counseling with him as well.
They can get started before they ever walk out of the doors.
Get started, yes.
That is wonderful.
And we're working with the Ascension Parish Jail on these issues. The Ascension Parish Jail does reentry classes for the inmates and talks about a lot of these things. And so what we do, we're going to start going in once a month. I was there last week. We're going to start going in once a month and just present all of these to the inmates who are in the reentry classes. And because we know that it's hard to come for counseling your very first time. You don't know what to expect, you don't know who's going to be there, you don't really know what they're going to do, and it's easier when you've made a connection And so hopefully that by their being able to meet with me and see me, and me telling them in person about these services, that'll kind of create a connection where it'll make it easier for them to come in and take part.
Okay. Yeah, they'll walk through the door feeling like, I know somebody here.
Yes.
I'm not alone. I don't have to worry about being judged. There's somebody who already knows I'm coming. So,
and you know, you don't have to feel, you know, bad because you were incarcerated.
Right.
These are services that are designed to help for you specifically, and so we want you to come and see us.
Right,
It's not, you don't have to worry about being rejected or us not having any services for you. We want you to come and see us and take part in these services. They're here for you. They're totally free, and so please come.
Yeah, it's an opportunity to redesign your life to fit into society and be successful. You know, turn things around for yourself. So please do come, because this is a great opportunity.
And in the Reentry Coalition, they call, you know, people who are being released from prisons, they call them returning citizens. And that's what we want to get across, is that you're citizens, you're returning, you have a right for these services. And let me just say that, you know, in Ascension Parish, these are all the things that we can provide. And that's because, again, because of our millage, and we can pay for the staff, and we have all of these things put together. There will be reentry services in other parishes. So if you're being released and you're going to another parish, you can check in with them and see what they have. It's going to vary by parish, and so, you know, you won't get the same services. Me personally, I believe that we provide the best services out of any other parish, simply because of all the resources that we have, and because all of this is just totally free for you. If you don't have a family in another parish and you've lost your home and you can move to Ascension Parish when you're released, I invite you to do that. Become a part of our parish, and then you can receive all of these services.
Okay. Well, this is wonderful. It's really wonderful to let the community at large know about this, as well as individuals who will soon be returning citizens.
Yes.
So it's a great thing. So thank you so much, Suzanne, for sharing this with us today. And I think it's going to bring a lot of people into our agency that we can really help.
Really do hope that it brings a lot of people in, and just the families you can come in too. You don't have to wait for your loved one to be released, but you can start planning now for their release. Start working with a counselor, start working with the social worker, and start making plans and preparations on how you can make their reentry back into your family as seamless and as easy as possible. So we invite families to come now. You don't have to wait till that person has been released.
Great. Thanks again, Suzanne, for
You're
all
welcome.
the great information. And thanks to you, our viewers, for spending your time with us for this episode of Ascension Counseling Center's video newsletter. You can catch replays of the program exclusively on Ascension 21 on the days and times listed on your screen, and anytime on Ascension 21's YouTube channel. We hope today's information will help change your life for the better. That's our goal at Ascension Counseling Center, for our programs to help change lives. Remember, Ascension Counseling Center is here by way of your support. We're funded by a 2-mil property tax millage, which means that $2 from every $1,000 you pay in taxes goes to support our agency, so we can provide free and low-cost mental health and substance abuse outpatient services to residents of Ascension. We're located in Gonzales at 1112 Southeast Ascension Complex Boulevard, off Worthy Road, across from the courthouse and next to the health unit. You can reach us by calling 225-450-1016. You can also find us on the web at ascensionparish.net/MH and on Facebook at Ascension Counseling Center. You can also hear us on KKAY AM 1590 every Tuesday from 10 to 10:30 a.m. Thanks for your support, and until next time, from everyone at Ascension Counseling Center, thank you for watching.